Hi everyone, welcome back into this video. So in this tutorial we shall be discussing how to insert IV cannulation for pediatric patients. So before you start the procedure, first you need to gather all the necessary equipment. For example, you will need a 24 gauge cannula, that is the yellow one. So this is the ideal size for children. So you will need a cannula that is the yellow, a 24 gauge cannula. You will need a disposable gloves for you to use as a tunic. So you will need a syringe plus a 21 gauge needle for you to flush the cannula. You will need a sterile water for injection for you to flush the cannula. So this is an sterile water for injection. So you will need swabs. This is an alcohol swab for you to clean the vein. So you will need an alcohol swab for you to clean the vein where you are going to give the shot. So you will need a cotton wool for you to apply pressure on the area where you are going to give the injection. You will need an IV medication for you to push through the cannula. So whenever we are doing IV cannulation for pediatric patients, there are areas where we are able to access veins. For example, the first place we can access veins is veins on dorsal of the hand, that is above the palm. So this is where we can access veins on the dorsal of the arm. Then the other place we can get veins is front of the elbow, that is the antecubital vein. Then if we fail to get veins on the antecubital veins, then we move to the external jugular vein, that is around the neck. Then if we fail to get a vein on the external jugular vein, then we can move to the head, that is the scalp veins. We can shave the head and access veins there. If we fail to get veins there, we can also go to the femoral veins, that is the thigh areas. So we can also access veins here. And if we fail to get veins on the femoral side, that is the thigh, we move to the ankle veins. So we can also access veins on the ankles. So these are the areas where we can access veins in children, especially pediatric cannulation. So tip number one, whenever you're doing IV cannulation for pediatric, the first thing you are supposed to do is when you apply the tunic, you have to do retraction. So you do retraction so that the vein will be very visible and very accessible for you to insert the needle. So this is how we are going to access IV cannulation for pediatric patients. So let us dive into the tutorial. Now, first what you do, you apply the tunic. So you apply the tunic. So you will get the alcohol swabs. So first what you do, you clean the vein like this. So you clean the vein first. You allow it to dry. So you dry it like this. Then what you do, you remove the cannula from its manufacturer's packaging. So you remove the cannula from its manufacturer's packaging. So you attach it gently. You remove the needle cap. You also remove the lower lock block. Then this is how you are going to give the injection. So you insert 15-degree angle deep into the vein. So when you insert like this, you will see a flashback here. So this is the first flashback. So you will see the first flashback in the cannulus chamber. Then you pull back the needle. Then you will see the second flashback into the cannulus chamber. Then you can advance the cannula deep into the vein like that. So let us proceed now. So let us proceed now.